Hi, welcome to OPA's walkthrough for the preview of the 2018-19 edition of the Healthcare Quality Report Cards. In today's presentation, we will go over items you need to review for your organizations. These include star ratings, measure level performance data, profile information, and finally, draft scoring methodologies. Health plans and medical groups are asked to review their star ratings at both the category and topic levels, as well as their measure level performance. Make sure you are on the 2018-19 preview website and that you have not clicked off into the current website. If you are unsure of where you are, look to see that 2018-19 appears at the top of the page, or that the web address or URL has RC2019 on it. We will start on the preview period web link that was sent to you. This is the full page. We're going to zoom in on the top of this page. Circled in red, you will see a link to the preview site. This preview site is where you will see the health plan report card link as well as the medical group report card link. This page is a temporary web link for the preview period. We will click first on the health plan link circled in red. Now we are on the main page for the health plan report card. Notice that we are now on the 5-star scale for the overall quality of medical care and for patients rate overall experience. Please review your scores on those two columns and then proceed to go to the right-hand side, here circled in red, to click through the topics that make up those ratings. So in the quality of medical care, you see asthma and lung disease care, behavioral and mental health care, preventive screenings, diabetes care, etc. In the patient's rate overall experience, you see the topics for getting care easily, satisfaction with plan services, satisfaction with plan doctors, and some additional ratings. We want you to click through each and one of these, and we will drill down through a sample right now. We will use preventive screenings as our sample, circled here in red. We will click through, and now we see the topic score for preventive screenings on the 5-star scale, and we also see the 4 measures that make up this topic score. You see breast cancer screening, cervical cancer screening, chlamydia screening, colorectal cancer screening. We will drill down into the colorectal cancer screening to show you how to click through. We are now on the colorectal cancer screening measure page. Here you see a description of the measure and how each plan performed. The green line represents the benchmark for top 10% performance nationwide. We will now continue with the medical group report card. Circled in red, we're going to click this link, and we come to a chooser page where you can choose by county or by the first letter of your medical group's name. As with the health plan report card, you see that there are the 2 columns now in the 5-star scale for quality of medical care and patients rate overall experience. You see that we have chosen San Diego for this sample, and underneath the columns are the quality of medical care and patients rate overall experience topics. As we did with the health plan report card, we would like the medical groups to go through each topic and drill down to the measures. Here, we will select appropriate use of treatments, tests, and procedures and click. We are now on the topic page for appropriate use of treatments, tests, and procedures in San Diego County. There is a description of the topic. There are the scores for the groups in that county. And in the little blue box, you see the 3 measures that make up the score. We have treating bronchitis, testing for cause of back pain, and preventing hospital readmissions after discharge. We will click treating bronchitis to see the measure score. We are now on the measure page for treating bronchitis. This is for San Diego County, and you see the description of the measure, what the score means, as well as the group's performance on this measure. We would also ask all of the plans and groups to review their profile pages. We would like your profile information to be correct and up to date. Anywhere your organization's name appears on a result is a link to your profile page. So we'd like you to check your customer service links to verify that they will direct them to the correct website, and verify the phone numbers that are listed here. We're using a made-up example of a group here to show you what the profile page looks like. On the left, you see the topics we've already discussed earlier, and the scores here will match those. And on the right-hand side is where we have your customer service information and county served, as well as a map. Please make sure that the phone number, the TTY, TDD number, customer service hours, and the website to your organization is correct. We would also like for you to review the draft scoring methodologies. Drafts were sent as attachments in the invitation to this presentation, and there will also be links to these in the temporary preview website. In closing, your reviews must be completed before 5 p.m. on October 19th. All requests for updates received after this date may not reflect on our launch date of November 7th. If you have any questions, please direct them to OPA report card at ncqa.org, or you may email Ruben Mejia at opa.ca.gov or Claudia Coons at opa.ca.gov. We thank you for your participation.